Hi, I'm Dave Jensen with CareerWise. I get asked a lot, is medical coding becoming obsolete? Uh, the invention of electronic health record systems and other technologies, a lot of people worry that coding is vanishing. I'm here to tell you that it's not. Coding, in fact, is growing rapidly. I don't know if you know, but last year in 2017, the Bureau of Labor Statistics, our government agency that tracks trends and growth in jobs, discovered that medical coding was number one. I think for 2018 it was in the top 5 or 6, but not number one. But coding is growing rapidly. I mean, the two major associations of certified coders has grown in excess of 10% CAGR, compound annual growth, every year over the last 6, 7, 8 years. I know a lot about technologies that are being introduced to try and automate coding. I've evaluated them, I've looked at them and reviewed them, and I'll talk about that more in just a moment. But one of the things that's driving the growth in healthcare is just pure consumption. The population is growing. We have an aging population as our baby boomers are now hitting their 70s. They're starting to consume more health services, and so we just have more and more health services that need to be read and translated and coded by medical coders. So the demand is just inherently growing because of the growth of consumption. Also, another trend I want to mention is there's been a shift over the last several years with the introduction of Obamacare to measuring health services by quality of care and by value-based care. Now, what this has done is it's made a bit of a shift in emphasis from what was very important as procedure coding with the CPT codes, but it's shifted now to diagnosis coding as being more relevant and more important when it comes to coding. Well, what this has done is that in 2015, the number of diagnosis codes went from 17,000 to over 150,000 diagnosis codes. Well, you can tell now that diagnosis coding is becoming more relevant and more important to help measure quality of care, that coding got a lot more complex, almost 10 times more complicated because of the numbers of codes. Now let me talk about technologies that have been introduced to try and supplant or replace the task of a medical coder, which is that of taking and translating clinical records into the right diagnosis and procedural codes. First of all, the advent of EHRs has allowed doctors to dictate their charts electronically and store them electronically. And yes, some of these EHRs do allow and provide tools for coding a record. The problem is that most physicians do not have the background or experience or training to know all the nuances of how to select the right level of care for an office visit. They don't know how to select the right diagnosis code. And many of the surgeries and procedures they perform are also sufficiently detailed. They just cannot keep track of this huge volume of codes. And interpreting and knowing how to apply those codes is very challenging for a physician. Most of them just don't even attempt it. They just hand it off to a coder. So as you can see, I mean, it is growing. Now, there are two leading technologies that have been introduced over the last 10 years, and hundreds of millions of dollars have been invested into what's known as natural language processing, NLP, also artificial intelligence, trying to automatically look at the semantical words and word structure in a clinical record and then make interpretive meaning as to what diagnosis and procedure code is reflected by the written word. And it's been very challenging for them to make a lot of success and a lot of headway with that. In fact, after a decade of effort and a couple $100 million in an investment, they've achieved about 25 or 30% accuracy just in a very thinly sliced diagnostic radiology sector with NLP. So I mean, the demand for coders is just going to continue to grow and expand. Tools will come along over a long duration of time that will help automate the process, but coding is a very hot and very high demand job opportunity right now, and from my perspective, it's not going to become obsolete anytime soon.